Hey everyone, welcome to GrowMed. In this video, we will look at the questions which were asked in the recent FMGE exam, that is the January 24. Okay, so we will look at the pathology questions. Along with that, we will also look at the topics from which the question was asked. So this is not a recall video. This video is more like a video on the high yield topics which you must learn for the upcoming FMGE. So there are chances that a question might be repeated from this topic. So in this video, we will look at the pathology. You can find the videos related to the other subjects, the anatomy, physiology, on my YouTube. So let's start the video. There was a question on the Philadelphia chromosome. They had asked the mutation associated with this. Okay, so as we all know that in Philadelphia chromosome that there is a translocation of the 19 and the 22. So the answer was the translocation. Then moving on, there was a question on the Turner syndrome on the chromosomal pattern of it, which is the 45XO, which is called as a monosomy. So there was a case describing the features of the Turner syndrome, and the question was asked which of the following chromosomal abnormality can be seen with this. So this Turner syndrome is a repeat topic. Every year question is asked on this Turner syndrome, so it is a must-do topic. So questions can be asked in the future also on this Turner syndrome. Then moving on, the next question, apoptotic bodies. The question was asked on its components. What all structures will make the apoptotic bodies, and it was the cytoplasm, intranuclear, and as well as organelles. All these things comprises the apoptotic bodies. Then moving on to the next question, there was an image given on the squamous cell carcinoma, a histopathological image, and you had to identify which type of carcinoma it was. Okay. Then moving on, a simple one-liner was asked that the Rietler syndrome, it is associated with which of the following, and it was HLA-B27. Okay, so it is an autoimmune disorder and occurs when there is HLA-B27 mutation. Okay. Then moving on, there was a question on the Cartagena syndrome. A case was there describing the features of the Cartagena syndrome, and you had to identify it as a Cartagena syndrome. Okay, then moving on, a neurofibromatosis 1. The question was asked which of the following is associated with the neurofibromatosis 1, and there were certain other diseases described, and from that you had to choose the correct statement. Then there was a case on the iron deficiency anemia, and in the case there was a point described which was low ferritin and high TIBC. These factors strongly suggest that the patient had iron deficiency anemia. Then there was a question on this MEN1 disease. So as we know that the MEN1 disorder, it comprises of parathyroid adenoma, then pituitary and pancreatic neuroendocrine tumors. Okay. So I don't know the exact question which was asked, whether it was which of the following consist of MEN1 or which of the following is wrong about the MEN1. Okay. But you need to remember that MEN1 se question aaya tha, and it was something like asked on the disorders. Okay. So you must read all the points related to the MEN1. Then moving on, there was a question on the sickle cell crisis, and a case was described. Okay. I think in the question they were describing the bone infection which happens mainly in the sickle cell crisis. So by looking at this point, it was very easy to make the diagnosis as the sickle cell crisis. Okay. Then moving on, there was a question on this IgM, immunoglobulin. Immunoglobulins also a repeat topic, must do, क्योंकि हर साल immunoglobulin से भी question पूछे गए हैं, and this time they had asked something related to the ABO incompatibility. ठीक है. There was something question like, in pregnancy the ABO incompatibility does not occur due to which of the following immunoglobulin. Okay. Then next, wound healing sequence. So they had given certain sequence of the wound healing, and you had to choose the correct option from that. Then infective endocarditis, a must do topic. इस बार infective endocarditis से दो questions पूछे गए थे. ठीक है. One was on the blood sample. So how many blood samples we will take, and for which organisms how much, the criteria for the blood sample, this was asked in the question. Okay. Then the next question, beta thalassemia. So this was also a case describing that the patient was having beta thalassemia and he had undergone blood transfusion. ठीक है. फिर blood transfusion के time पे he developed fever, tachycardia, hypertension, features something like this were described in the question. ठीक है. And there were certain options given like stop the blood transfusion, do the matching of the blood, continue the blood transfusion. ऐसे कुछ options दिए गए थे, and you had to choose the proper correct option from the following. ठीक है. So this was a list of the important topics and the questions which were asked in the recent January. आई होप यू फाइंड दिस वीडियो यूजफुल इन योर प्रिपरेशन. जो भी जुलाई के लिए प्रिपेयर कर रहा है, आई थिंक दिस वीडियो विल हेल्प यू इन योर प्रिपरेशन. थैंक यू so much for watching this video. Share this video with your friends. Subscribe to GrowMed for more content related to the FMGE. Thank you guys. Bye bye.